Have you ever stopped to think that the very vitamins you're faithfully taking every morning might be doing more harm than good? It sounds unbelievable, even a little scary. But for adults over 65, some common supplements may quietly be increasing your risk of heart problems, nerve damage, and even premature death. According to the Journal of the American Medical Association, seniors who take the wrong vitamins face up to a 40% higher risk of dying early. That's not an internet rumor. That's peer-reviewed clinical data. As we age, our metabolism slows. Our liver and kidneys become less efficient, and yet many people continue taking the same supplements they started in their 30s and 40s, not realizing that their body has changed and its needs have changed too. In this video, we'll uncover the 4 vitamins that may be silently harming you after 65, and the 4 you absolutely should take every single day to protect your mind, your muscles, your heart, and your independence. Let's begin with the ones you need to be cautious about. First on the list is vitamin A, especially in its retinol form, the kind found in most multivitamins and liver-based supplements. Now, vitamin A does play an important role in immune health, vision, and skin repair. But the retinol version is fat-soluble, which means it's stored in your liver and fatty tissues instead of being flushed out like water-soluble vitamins. And here's where it gets dangerous. After 65, your liver function naturally slows down. So the vitamin A you take today doesn't just disappear, it builds up over time. That accumulation can quietly lead to vitamin A toxicity. Symptoms are subtle: dry skin, dizziness, blurry vision, joint pain. Many seniors mistake those signs for aging, when in reality, their multivitamin may be to blame. Even worse, excess retinol has been associated with atrial fibrillation, an irregular heartbeat that significantly increases stroke risk. The safer alternative is beta-carotene, found in foods like carrots, sweet potatoes, spinach, and eggs. Your body only converts beta-carotene to vitamin A when it actually needs it, making overdose virtually impossible. Next, let's talk about iron. Iron is essential for transporting oxygen in your blood. But here's the problem. Most seniors don't need supplemental iron. After menopause in women and after puberty in men, the body retains iron more efficiently, and it no longer loses it through menstruation or rapid growth. When you take unnecessary iron supplements, that iron doesn't just leave your body. It gets stored, mostly in your liver, heart, and pancreas, and over time, it contributes to oxidative stress. That's when free radicals start damaging healthy tissue, increasing the risk of heart disease, joint problems, and even cognitive decline. High iron levels have also been linked to Alzheimer's disease and liver damage. Unless you've been diagnosed with iron deficiency anemia or chronic blood loss, chances are you're getting more than enough from your diet. Meats, beans, leafy greens, and even fortified cereals all provide iron. If you're unsure, ask your doctor for a ferritin and transferrin saturation test. If your levels are normal, ditch the iron and switch to an iron-free multivitamin designed for seniors. Third is calcium. Specifically, calcium taken in pill form. We've all heard it. Take calcium to strengthen your bones. But the truth is more complicated. After 65, your bones absorb calcium less efficiently, and without vitamin K2 and vitamin D3, that calcium may not reach your bones at all. Instead, it may harden inside your arteries and joints, contributing to calcification, high blood pressure, and an increased risk of stroke or heart attack. Seniors taking large doses of calcium supplements without balancing nutrients may think they're protecting their bones, but they're actually raising cardiovascular risk. On top of that, calcium supplements can cause bloating, constipation, and interfere with the absorption of other minerals. A better approach? Get your calcium from foods like leafy greens, sardines, with bones, almonds, chia seeds, and yogurt. And if you do supplement, make sure it's combined with D3 and K2. These guide calcium into your bones, not your arteries. Fourth is vitamin B6, a vitamin commonly recommended for nerve health, brain fog, and fatigue. But in high doses, B6 can become neurotoxic, especially in older adults with slower metabolic clearance. It's water-soluble, yes, but unlike most other water-soluble vitamins, B6 can accumulate in nerve tissues and cause real damage. We're talking about tingling, numbness, burning sensations in the feet or hands, poor balance, and muscle weakness. Many seniors suffering from these symptoms are misdiagnosed with diabetic neuropathy or natural aging, when in fact, they're simply taking too much B6. The recommended daily intake for older adults is only 1.5 to 1.7 milligrams, yet many multivitamins and nerve support formulas contain 20, 50, or even 100 millimonomers, far more than necessary. Unless you've been prescribed a high dose for a confirmed deficiency, it's best to stick to food-based B6 sources: chickpeas, tuna, salmon, turkey, potatoes, and fortified cereals. Now that we've covered the risky vitamins, let's move on to the ones that truly support your health after 65. Let's start with magnesium, one of the most critical but underappreciated nutrients in aging. Magnesium helps regulate blood pressure, stabilize blood sugar, support muscle and nerve function, and promote deeper sleep. But as we age, magnesium absorption drops, and medications like diuretics, acid blockers, and even some heart drugs strip it from your system. Symptoms of low magnesium, like fatigue, muscle cramps, poor sleep, and anxiety, are so common in older adults that they often go unrecognized. Yet when magnesium is restored, many people experience better sleep, fewer muscle twitches, improved mood, and sharper focus. The best forms for seniors are magnesium glycinate, citrate, or malate, all gentle on digestion and better absorbed. Aim for 250 to 400 milligrammes per day depending on your needs. And don't forget food. Leafy greens, black beans, almonds, pumpkin seeds, and avocado are all great sources. Next, vitamin D3. Your skin produces vitamin D when exposed to sunlight, but after 65, your skin becomes less efficient at that process. And many older adults spend more time indoors or wear sunscreen that blocks UV exposure. The result? Widespread vitamin D deficiency. Low vitamin D has been linked to bone loss, muscle weakness, fatigue, depression, and a weakened immune system. Even more alarming, it's been associated with increased risk of infections, diabetes, and cognitive decline. The recommended dose for most seniors is 1,000 to 2,000 IU per day. But your doctor may recommend more if blood tests show you're deficient. Make sure you take D3, cholecalciferol, not D2. It's more bioavailable and mimics the vitamin D your body produces naturally. Take it with meals that contain some fat. This improves absorption. Third is vitamin B12, absolutely essential for brain and nerve function. After age 60, your stomach produces less acid, which is needed to extract B12 from food. So even if you eat meat, fish, or dairy, your body may not absorb enough. A deficiency in B12 can mimic dementia, cause balance problems, fatigue, and even permanent nerve damage if left untreated. The good news? It's easy to fix. Oral supplements in the form of methylcobalamin or cyanocobalamin bypass digestion and go straight into your bloodstream. For seniors, the recommended dose is usually 500 to 1,000 mcg daily. If you're severely deficient, your doctor may recommend injections. Either way, B12 is safe, well-tolerated, and crucial after 65. And finally, omega-3 fatty acids, specifically EPA and DHA. These essential fats reduce inflammation, protect brain function, support heart health, and improve joint mobility. Multiple studies have shown that seniors with higher omega-3 levels live longer, have lower rates of heart disease, and experience less cognitive decline. Yet over two-thirds of Americans over 60 are deficient, mainly because they don't eat enough fatty fish. To get what your aging body needs, you'll want to supplement with at least 1,000 to 2,000 mg of combined EPA and DHA per day. Choose a high-quality fish oil that's been purified and third-party tested. If you're vegetarian, opt for algae-based omega-3s. These offer the same brain and heart benefits without the fish. So here's the bottom line. After 65, it's not about taking more supplements, it's about taking smarter ones. Some vitamins that once helped you can now quietly harm you. Others that never seemed important may now be the key to your strength, memory, and independence. Check your labels, talk to your doctor, and build a supplement routine that's right for your body today, not your body 30 years ago. Let us know in the comments which vitamin surprised you the most. And if you found this helpful, give it a like. Share it with someone who needs to hear it, and don't forget to subscribe. We're here to help you live stronger and longer, one smart choice at a time.